Ladies and gentlemen, welcome back to On the Mike King here. This is part of the Mike King Biz Media Network, which happens to be ESPN Richmond 106.1 International Business Group Radio, Saturdays, 10 a.m. Eastern, as well as CW Richmond TV. What we do is we talk to the best and brightest. We showcase how RVA and the business community are making things better. Alrighty, so today we got an old friend came back to the program, Patti Jackson of Massey Cancer. Welcome back, ma'am.
Thank you, Mike. Nice to be with you.
All righty. So it is a business show. So tell us who you are and what you do.
So I'm Patti Jackson. I'm the Senior Director of Development for Massey Cancer Center, which means that I have the great privilege of working with our donors and corporations and foundations that support the great work that our researchers and our care providers are giving at Massey Cancer Center.
A lot of times people who are here don't understand that Massey is on the forefront, the cutting edge, and shout out to Dr. Wynn for, making people understand exactly what's happening here with what you guys are doing. Give us some insight into that.
Well, thanks. Yes, Dr. Rob Wynn has been our Cancer Center Director since December 2019, so almost 4 years. And his mission has really been to increase the capacity at Massey by recruiting some just wonderful world-class researchers and care providers to Massey to add to the already stellar team that we have, and to increase the number of clinical trials that we're able to offer to our patients, which gives them the opportunity to have the latest and greatest treatment that comes out of the research that's being done here and elsewhere. And he has really made health equity an underpinning foundation of everything that we do at Massey, so that everyone has equal access and equal care if they have a cancer diagnosis. And so we've been really expanding our efforts throughout the catchment area, which is 66 counties and cities across Virginia. But he's also helped us to partner with team science grants under Stand Up to Cancer and some other opportunities, partnering with and collaborating with cancer centers across the country.
So you had said you guys were just given an honor, a designation. Let's talk a little bit about that. That's important.
Yeah, so all of these efforts, and as well as the efforts of Dr. Wynn's predecessors and the rest of our team, have led us to apply for and receive comprehensive cancer center designation from the National Cancer Institute. So this is the top level of cancer centers. We're in the top 3% across the country now, along with cancer centers like Johns Hopkins, MD Anderson, Memorial Sloan Kettering, some of the others that people hear about. And this is really a tribute to all the work that our researchers have done, to these team science grants that we've been able to collaborate on with other cancer centers, to the work that we're doing on health equity and closing the gap on health disparities, and just recognized as a leader on this. So having this facility right here in Richmond is terrific, and one of only 2 comprehensive cancer centers in Virginia and one of 54 nationwide.
That's an honor. And a lot of times people don't realize. So when I talked to you before, I talked to Dr. Wynn, we don't look at cancer the same way that we did years ago when I was young. I'm 63. So you didn't even say cancer back in those days. But now people are living with, fighting with it, and also, but a lot of times it does take the research. And that's what you guys are doing. How do you recruit the researcher? Because a lot of that goes off and we don't hear about it. And then all of a sudden, how do you guys recruit the best and the brightest to come? I guess with the designation that says we are good.
Well, that is certainly a big help. And I think, but I think also just Dr. Wynn and the connections that he has around the country, he's been able to recruit folks that he's worked with in other locations. And then as people have been hearing about the great work going on here, they're very excited about it. You can hear from some of these newer recruits about how excited they are to be a part of Dr. Wynn's team and really be on the cutting edge of the research that's being done. And so I think, that is something that attracts them. They want to be at a place where they're also training the next generation of cancer doctors and researchers, so that work that they're doing is continuing. But we're also seeing the results of that research. So we're seeing more cancer survivors, as you mentioned. There are right now over 18 million cancer survivors in this country. So that's pretty phenomenal. And one of the other things that Dr. Wynn's been able to focus on is to get a more active survivor program going. So he has recruited Dr. Susan Hong, who has come in, and she's over the survivor program that we have. And she's just doing some great work to provide more holistic care for cancer patients as they're living with cancer. There are, a lot of other things that come along with that than just really trying to have a broader, comprehensive care for those patients.
So you are a nonprofit, correct?
Yeah, so we operate through the MCV Foundation for all of the development dollars that come in, all of the philanthropy dollars that come in as a nonprofit. Yes.
One of the things is, and we've had this conversation before, and everyone thinks that Massey Cancer has tons of money and resources. They're not like us, the little person over here. And I see the smile on your face. Let's talk about the things that you guys need, because I always say, changing the world ain't cheap, easy, or free. So money got to change hands somewhere. Right. So, ma'am, here's your time to tell folks about what you guys are doing.
Well, thank you. I mean, we have been very fortunate to receive federal and state dollars, so we're very grateful for that. But we also do rely on philanthropy for about a third of our budget. And so this is really the generosity of our individual donors, corporate donors, and foundations that believe in the work that we're doing and want to continue to see the advancements that are being made at Massey to improve the quality of life for our cancer patients and our communities as a whole. So just to give you an example, as we're trying to increase our outreach, we received some corporate and foundation funding for 2 mobile health vans that have just arrived. And we had a few delays with the pandemic, but we have 2 mobile health vans that are equipped, and we're going to be going out throughout our catchment area into the rural areas, really helping people connect with Massey on just being educated about when they need to get their screenings, where can they get those screenings, where can they get treatment, and then what are some of the things that they can do to prevent cancer. So it involves a lot of different facets, things around tobacco cessation, healthy eating, but like I said, getting those screenings, because in some of these hotspots that we've seen where the cancer incidence rates are higher, and in some cases the death rates are higher from cancer, it's often because of a late stage diagnosis. So we really want people to know when to get those screenings, to get them, and then to have access to care. And so just thinking too that, Massey is a safety net hospital. So we provide care to everyone, regardless of their insurance status. And so that is a cost. And that, we're trying to make sure that we can provide the best care to our patients, to everybody who comes through the door, but we're also reaching out to more people in the communities where the need is great, to make sure they have access to that care too. So it takes a lot. It takes a lot for the research to be done. It takes a lot to recruit these world-class researchers to do this cutting edge and innovative research. And so it really does depend on the generosity of our communities to help support them.
Sometimes I think that people, they get lost, and the donation turns into a direct line to vans being able to go out to other areas, where people may not be able to get the resources that they need. And now a person's donation all of a sudden made that happen. Really quickly as we get out of here. So before, when I saw you, we talked about the pandemic. What did you learn from the pandemic? And you didn't do before, but now you're like, hey, that thing is pretty good. We're going to continue to do it.
Well, 2 things that come to mind. I mean, one is, and I think a lot of the healthcare facilities have found this, is that people were able to use telehealth very effectively, and that has continued, and that has provided access to care and to those caregivers for people who may not have ready physical accessibility. So maybe they live an hour or 2 away from Massey, but they want to have that telehealth visit. So that's something that we've seen an improvement increase in. And then the the other thing is that the pandemic did put a very bright spotlight on the whole issue of health disparities, the lack of access, how some communities were impacted more greatly by COVID than others. One of the things that Dr. Wynn did, along with the faith-based community and some of our board leadership, was to start the Facts and Faith Fridays. So every Friday, every week for 3 years, we had an opportunity online for faith leaders, for community leaders, for anyone in the community really who wanted to participate, to hear about what was truly happening around COVID, what was happening around cancer, to really have those facts out in front of our faith leaders so they could share that information with their congregations, their communities, and make sure that they were getting the best information from the brightest and the leaders in the medical community. And that has continued. It's continuing now on a monthly basis, but it still is a great resource for a very broad community to address health disparities. And then, as I said, with our vans, getting out into the communities more and sharing that information. So we're going to the patients, to the communities, rather than waiting for them to always come to us. One of the things Dr. Wynn talks about is how, in the past with research, it's been bench in the lab to bedside to the patients, and then it became bench to the community. And now we're talking about community to the bench. What are the needs the community has, and how can our research be driven best by those needs?
So my man, Dr. Wynn, he does explain it in a way that we understand, because a lot of times, like I said, we don't understand that part that goes on. And then all of a sudden the cure shows up. But a lot of work went into that. So, ma'am, it is always a pleasure. You always got a home here. How can people find you and information out about Massey?
So the best way is to go to our website, masseycancercenter.org. There's lots of information there about the things we've talked about opportunities to support Massey. If anyone wants to reach out to me directly, I'm happy to talk with them. My email is jacksonp2@vcu.edu, or you can reach me, through LinkedIn or social media, any of those. So I'm happy to help, but our website's probably the easiest way to get more information.
All right, ma'am, it is always a pleasure. Thanks. Now, appreciate it. Take care now.
Thank you so much, Mike. You have a good one.
Take care. Bye-bye.
Thanks. Bye-bye.